The question is what makes a patient a good resection candidate? I would start by saying that the two curative modalities that are established in the treatment of hepatocellular carcinoma are liver transplantation and surgical resection. Given the limited supply of organs and given the long-term impact of having a liver transplant, surgical resection remains a very viable option for such patients. However, surgical resection is limited by various factors. The main limitation to surgical resection is the availability of or the amount of residual liver that will be left behind that is healthy to sustain life. So having advanced cirrhosis or having significant portal hypertension will preclude the patient from having surgical resection. So in other words, to look at the other side of the coin, the patient has to have well-preserved liver function. So generally Child-Pugh A cirrhosis with limited or no signs of portal hypertension. So depending on the institution, things like a normal bilirubin may be regarded as a requirement for resection. A platelet count that's within the normal range or above 100,000 would be a requirement. And the absence of glaring signs of portal hypertension, such as esophageal varices, for example. Another limitation to surgical resection is the size of the tumor and its relationship to blood vessels in the liver. So these are technical decisions that have to be made by an experienced surgeon to determine whether it would be appropriate to do a resection and not affect viral vasculature in the liver. A third limitation is whether there is vascular invasion. So if the hepatocellular carcinoma invades the portal vein or the inferior vena cava, these are thought to be poor prognostic markers, and the outcomes after surgical resection would be poor. So these patients are usually not sent for surgical resection. Now there are some other relative contraindications, but these again are relative and depend on institutional practice and the context and the availability of other treatment options. Having multifocal disease is usually a relative contraindication to surgical resection because the risk of recurrence increases with the increasing number of lesions in the liver.